So when people think about moving to Thailand, healthcare obviously comes up a lot, which is great because it's a really important topic, but there's lots of nuance to it. So in today's video, I'm going to walk you through everything you need to know, and by the end of the video, you'll have a much better idea as to how Thailand's healthcare landscape works, what to expect, how much it costs, and a lot of understanding on the insurance side of things as well. Some real nuance there. I'll chapter out each of the sections so it's easy for you to navigate through everything. With that said, let's get into it. So let's just start with the basics here. Thailand operates on what's essentially a two-tier healthcare system. You have the public system and the private system. But let's talk about the public system first. So obviously, Thailand's public hospitals are government-run facilities that offer care at lower costs compared to the private systems that there's so many other YouTube videos about. The doctors at these government facilities are still very much real medical professionals and are still very qualified, just like those in the private facilities would be. But there are some key differences. So first off, obviously it operates much more like a traditional single payer system that you might be familiar with from countries like Canada, which is where I'm from, for example. And because of this single payer system, waiting times can be pretty long. You know, on top of that, the facilities themselves are far more basic. So just think very standard government hospital style environments rather than the luxury five-star hotel-like settings you'll find in a lot of the private hospitals. On top of that, language can also be a bit of a barrier. And yes, you will find some English-speaking staff working in government-run hospitals here. It's not always a guarantee, and you might need to rely on some translation being done or bring a Thai friend, Thai colleague, Thai partner to just help with that communication barrier, because, you know, speaking English isn't necessarily a full-blown requirement like it might be at some of the private hospitals here. Now, here's another important point related to the public system. As a foreigner living in Thailand, you're not entitled to free care in the public system unless you're actually employed by a Thai company, whether it be your own Thai company or a big Thai company that you're simply an employee for. And here's the key thing though, actively making the mandatory social security contributions as part of that. So, you know, if you're a retiree or if you're a remote worker that's not actively employed here and actively paying into the social security system here in Thailand directly from your paycheck, it doesn't mean you can't access the public system. It just means you'll need to pay for it out of pocket or through your insurance. Now, with the basics of the public system covered, let's talk about the private system now, which is where a lot of long-term expats end up, particularly those living in the big kind of expat and or tourist hubs. So obviously, Thailand's private hospitals are world-class. Most of you probably already know this. And quite honestly, they compete with some of the best hospitals anywhere in the world. And again, as a lot of you probably realize, the facilities in these private hospitals or private clinics or private practices often feel like five-star hotels, more so than medical settings or healthcare settings. The staff at these establishments typically speak really, really good English, which reduces any sort of language miscommunication issues, and the waiting times are generally minimal or non-existent altogether. You can often walk into these private practices, again, whether it be, you know, a big hospital like a Bumrungrad or a Bangkok hospital, or just a small private clinic. You can walk into these usually without an appointment, and generally be seen right away. On top of this, a lot of the private hospitals have direct billing relationships with both Thai and non-Thai insurance companies and insurance providers, which generally makes the payment side of things pretty straightforward. Now, moving on, some of the differences here between the public system and the private system. One of the biggest advantages to Thailand's healthcare system at large is the cost, but sometimes it's not actually as cheap as you might think or as expensive as you might think. So I think it's important to understand what you're actually looking at in terms of expenses. So I figured, let me illustrate some real numbers to you. So I worked with a Thai buddy of mine to create the chart that I'm about to show on screen. He called all sorts of Thai government hospitals, and I called a bunch of Thai private hospitals to put this together. So quickly, just on the left side here, you'll see the cost range for treatment in the public system, or in the case of something like basic teeth cleaning, I guess just a more, local Thai-centric clinic. And on the right side, you'll see the pricing for the big international hospitals. And again, in the case of the teeth cleaning, the fancy dental offices. Okay, so I hope that gave you a decent range for the cost of things. Again, I didn't just make these numbers up. Thai buddy and I actually did the reconnaissance here and hit the phones to create this chart. And I get it, it might not be perfect. And yes, of course, there's always going to be some variance based on someone's independent, unique situation. But I do feel it is a fair representation and helps provide some decent context as just to why medical tourism in Thailand is such a huge industry. It's often very affordable. Now, as far as purchasing insurance goes, this is an area that isn't necessarily as obvious as you might think. So I myself have an insurance plan from a US-based company that provides me up to $3 million US, not bought, worth of coverage, and also includes all sorts of other benefits as outlined here. Given that I'm generally a pretty risk-averse person when it comes to this kind of healthcare stuff, my plan even has a $0 deductible, which I do pay extra for my annual premium. That said, I'm a healthy 27-year-old with no pre-existing conditions. So, at $1,400 US a year, this policy for me and people like me felt like a no-brainer. But as you get older, and depending on what your situation is, it might not feel like such a no-brainer when you factor in the increase in premium pricing, and even more importantly, when you factor in coverage exclusions on pre-existing conditions or coverage refusal altogether, right? Like, this is where it can get a bit messy, and it's just not as clear-cut as you think it would be. For example, I have some family friends down in Koh Samui who are retired Americans deep into their 70s, and crazy enough, they opted not to purchase insurance. But they're not dumb for this. They've thought it through quite in depth. So they have Medicare in the US, and then on top of that, they have a private US supplemental insurance plan that covers the gaps in America between what they want coverage for and what their Medicare covers. They purchased a supplemental plan that covers the gap there. Now, as part of that supplemental plan, they also get coverage on their first 90 days overseas, their first 90 days abroad. So, since they spend 8 months a year in Thailand, they have a 5-month coverage gap, right? Because Medicare doesn't cover them in Thailand, and their supplemental American insurance plan that they use, quite honestly, for additional coverage in America, that has a stipulation with it that they're also covered for their first 90 days per calendar year abroad. So they max out that 90 days. They're in Thailand for 8 months. Their first 3 months are covered. There's a 5-month coverage gap, right? That's how that math and that timeline works out. Long story longer, given their situation and their financial picture, they've decided to not purchase insurance, and they self-insure during that gap, and they pay out of pocket for any issues. You know, their thought on this is, while it would suck, they could pretty easily afford up to like 30 grand worth of out-of-pocket expenses if disaster were to strike. And in the case of something like a cancer diagnosis or something catastrophic like that, they would just return to the US, where they have their Medicare and they have that supplemental American insurance plan that, you know, brings them to maximum coverage inside of America. Now, I'm not saying this is the right move. It obviously comes with risk, but for them, it's just the most efficient solution given how expensive insurance policies can be for those deep into their 70s, plus the fact that many insurers won't cover those with pre-existing conditions. This particular duo, this particular couple, looked around, they did their shopping, and they just couldn't find an insurance plan that was reasonable pricing. They looked at their situation on all angles, they did their math, and they looked at the risks, and they made their own assessment with full acknowledgement of the risks at play. That's what I mean, how as you get older, you know, sometimes, surprisingly enough, the reality of to buy or to not buy insurance becomes less clear. You know, what you should probably do as far as the insurance conversation goes is to just have a chat with a trusted insurance broker, just as a starting point to walk you through your options. That's what I did, and it was, I think, a really good play. And what that allows you to do is understand the facts of your case, understand what your coverage options are based on your specific situation, and really just a 360 view of what it would cost to get the type of insurance that you'd want to purchase, right? And especially given that these insurance brokers work on a no-fee basis and they just work on a commission basis, they get paid out from the insurance company. To me, it feels like a no-brainer. Now, all that said, as we've discussed in previous videos, sometimes you don't even have the choice as to are you going to purchase or not purchase insurance. Sometimes you have to, at least some version of an insurance plan. And that's because there's multiple Thai visas that actually require health insurance coverage in order to be approved and be issued that specific visa. For example, the non-immigrant OA retirement visa requires coverage of at least 3 million baht or 100,000 US dollars from approved insurance companies. So if you're applying for this visa, insurance isn't optional, it's mandatory, you have to buy it. Now on top of that, the various LTR visa categories also have similar requirements where you may need to show minimum coverage thresholds depending on which pathway you choose to go down. This ultimately leads to what many expats call throwaway plans, which are pretty much the most basic insurance policies possible that just meet the minimum visa requirements. People buy them solely to satisfy the checkbox for said visa. Is this ideal? Probably not, but it's a reality of the visa system in certain cases and how that affects decision-making on the insurance side. Now, moving on here out of insurance and into a different type of healthcare altogether. So one thing that really sets Thailand apart from a lot of countries is the emphasis and options available as far as preventative and wellness care goes. So this isn't just about treating illness, it's about like actually maintaining and improving your health proactively. So let's start with executive health checkups. so many clinics and so many hospitals all over the country offer really comprehensive, like annual full body screening packages that would typically cost thousands and thousands and thousands of dollars in Western countries, but here are much more affordable. They generally include blood work, body imaging, cardiac testing, cancer screenings, one-on-one consultation with all sorts of specialists, the whole 9 yards. It's really impressive, and there's lots of expats that take advantage of that as part of their lives here and get that done every year or two. On top of that, dental care is another area where Thailand really excels. Regular cleanings, cosmetic work, orthodontics. The quality is exceptional and the costs are pretty competitive to, what you'd pay in other countries similar to Thailand. I think Thailand is amongst the best in the world for the dental care category. Vision care is also equally as impressive, from eye exams, prescription glasses, contact lenses, LASIK, eye surgery. It's all available, it's all here, and it's all of extremely high quality. Also, physical therapy, rehab services are also excellent. So whether you're recovering from an injury or dealing with chronic pain issues, you'll find qualified professionals with world-class equipment and world-class facilities all over the country. But another area where Thailand really shines is the fitness space and the activity space. So, gym memberships can range from incredibly affordable to full-blown luxury experiences. You can find basic gyms, mid-level gyms, high-end clubs, yoga studios are everywhere, martial arts training is everywhere, whether it be boxing, jiu-jitsu, Muay Thai. You also have ice bath and sauna facilities everywhere. The point is, you have every opportunity here to really, really proactively maintain your health. Now, as far as prescriptions go from your home country that you're going to need to get issued in Thailand as part of a potential move here, you're probably not going to be able to bring that prescription right up from your home country and expect it to be filled in Thailand if the medication requires special permission or a prescription, right? So, if you take specific medication in Canada, in the US, in Australia, in the UK, from wherever, and you need that here in Thailand and it's not available over the counter, you're gonna have to visit a Thai doctor and get a new prescription for the same medication here in Thailand. It's usually pretty straightforward, especially if you bring the documentation of what you've been taking from your home country, but it does require that extra step. Now, as far as opiate-based medications go, so these are highly regulated here in Thailand, and you'll need Thai FDA permission to bring them with you into Thailand. And again, if you want to get prescribed them here, you'll need to consult with a Thai doctor to get a new prescription here in Thailand. Just quick tip here before we move on. Standalone pharmacies are almost always the best way to get your medication, i.e., they're better to get your medications filled versus, a private hospital or a fancy private clinic. So, if you get a prescription from a doctor at one of these private clinics or private hospitals, just get it filled at, any of the pharmacies in Thailand, whether it's Boots or Watson's or Tops, or even some of the mom and pop pharmacies that are independently family owned. The savings can be pretty substantial. They can add up. Now, let's talk about what to do in emergency situations. So in most of Thailand, the primary emergency ambulance number is 1669. So this is a nationwide number that will connect you to emergency medical services. I know we've covered that in another recent video, but I figured I'd mention it here again. And in Bangkok specifically, you can dial 1646 for ambulance services. Now, something that most people don't realize is that you can also call private hospitals directly and request ambulance services. So, let's say you're retiring to Koh Samui, for example, and you get yourself pre-registered at Bangkok Hospital down there, with your insurance, with all of your details. You're a pre-registered customer at Bangkok Hospital Samui. Well, you can also save their emergency ambulance number, and the Bangkok Hospital ambulance you can call if you, God forbid, have an emergency on the island. That is another option to get emergency dispatch services, and you can generally do that all over the country. So that's just one thing I also wanted to mention. Now, as far as annual costs go for different types of expats living here in Thailand, it really is impossible to give standard budgets. It's just not something that's an achievable task, because everybody has their own situation and everybody gets different treatment, has different insurance plans, doesn't have insurance plans, goes to different clinics. So I can only comment on my situation as a 27-year-old, male living here that's in pretty decent shape. Between my insurance plan, which is $1,400 a year, between, an annual trip to the dentist, between the odd check-in with a doctor, between a pretty basic full body physical that I get done every year, I would say that I probably spend $2,500 a year for healthcare and all my healthcare needs as part of my own expat life here in Thailand. But you got to remember, there's people that spend way less than that. Maybe they don't need to spend more. Maybe they choose not to spend more. But there's also people that spend far more to that. I read comments sometimes on my YouTube channel, and people have told me that as part of their long-term retirement, for example, all the healthcare costs really start to eat in to how affordable they thought Thailand was going to be. It goes from being an affordable place to a non-affordable place because of that healthcare requirement, which if they're from a place like Canada, they could have gotten for free or with their tax dollars in their home country. But they don't get that here. They can't even tap into the public system here because they don't pay into Social Security. So that's just a really, really, really important point I wanted to hammer home is yes, healthcare in Thailand can be affordable. Yes, it is world class, but it can still get expensive, particularly for retirees. So this is a serious consideration. Now, with all that said, I hope you enjoyed this video. I could have gone so much deeper into each individual topic, and I will in future videos, but I just wanted to give what I thought was a solid 30,000-foot view into the healthcare landscape in Thailand. So hopefully you enjoyed it. Hopefully that was helpful. And if you want more information-heavy content from me, then I'd highly recommend you check out my weekly newsletter. A new edition goes out every Sunday morning. I put just as much work into that as I do into these videos. So check that out. You can click below or scan right here on this graphic. And with that said, I will see you next week. I hope you enjoyed this one. Cheers.